So hello, my name is Helen Prytherch. I'm a social and political scientist. Have been working abroad in different functions, different health systems for several years before joining the Swiss Tropical and Public Health Institute in 2014. The role of the Swiss Tropical and Public Health Institute, Swiss TPH, in this project was as implementing agency. So when the call was out, we have, of course, bid at the time and been awarded this mandate and implemented it, of course, through a local office and a local team of experts, mainly based in Dushanbe. My own personal role in the project since 2016, I have been in the role of the project director. So we have this construct that the manager of the project is based in Dushanbe with the rest of the team, and the director function is then in Switzerland. So more on the strategic questions and the overall oversight and for quality assurance. So coming to the most important outcomes of the project, there were two main ones. The first one is focused more at the institutional level. So it was building the capacity of the Ministry of Health and Social Protection and associated institutions for them to have stronger management and planning capacities. So here, really, there's been a huge impact with national level tools developed by the project on business planning. And also a modular primary healthcare management course that was set up. The business planning tool was also evaluated by WHO at the request of the ministry. And for both the business planning and the management training, costing work was done to really show that these are innovations that can be supported by the system going forward. They're now part of the national strategy, with also a department of business planning set up in the Ministry of Health to operate this going forward. The second big outcome of the project was at the community level. So the project was supporting the ministry to have a national guideline on how to engage communities in issues relating to their health, and a whole package of supporting documents around that. So that's also been a key achievement. And I would not like also to omit to mention medical education. I think we can't talk about improving the quality of primary healthcare without looking at the competencies of family doctors and nurses. And really, this was a revolutionary aspect of this support from the Swiss side, that for medical students, there's now a clinical year 6 in Tajikistan, so they are exposed to the rural realities early in their training. There's a 2-year training for the family doctors, with also really showing that these are more strongly capacitated family doctors when they come through that system, and there's a credit-based system of continuous professional development. So in terms of lessons for the wider region, I think the first ones really relate to the whole process of scale up and how to take an innovation in the health system to scale. So I think this was very much the situation with the business planning approach that has really gone into national strategy documents, full ownership now on the side of the Ministry of Health and Social Protection. As well, we have the management modular course, the training course, which has been integrated into the national curricula. It also succeeded to run remotely in the times of COVID, and it's also caught the attention as well of the World Bank. The World Bank is very interested to provide ongoing support to this modular course going forward. So I think the second area where there are lessons learned for the region do relate to the exit planning that was done in the project. So we were stepping out of direct implementation 2 years to 18 months before the end of the project, and really handing over the support to the implementation for the business planning and for the community work to the Ministry of Health and Social Protection. And we were stepping into really a background role there in case they had questions, following up, but they were really in the implementation, in the driving seat, and reporting to those higher up in the ministry. So we really hope that this process is going to continue now as these topics have been taken up as well, really as national questions. The third area, I mean, I think simply at the level of policy advice, policy exchange. For the size of the project, this was unprecedented, I think, in the Enhancing Primary Healthcare Services project, extremely close to the Ministry of Health and Social Protection. They knew that we could give them advice on policies and how to proceed in a very difficult operating context with very limited resources. They knew that we were rooted in the work that was going on at the district and the realities that were being faced in the district. And finally, I think the project was very recognized for generating evidence. There is not a lot of evidence coming out of the health system in Tajikistan. So there were always surveys ongoing into the quality of care, tracking the improvements over time, into the increase in health literacy, looking there and really also there we saw increases. And as a proxy for access to services as well, we were tracking over time the amount of out-of-pocket expenditure that people were having to pay to get service.